here at the ERIC meeting, there's been a lot of discussion around future options in CLL treatment. I think firstly we need to remain aware that either through economic realities or given the nature of patients with the disease, older or frailer patients, that single agent therapies, and the BTK inhibitors such as ibrutinib are a very good example of that, that are able to deliver good disease control over the medium term, are very, very good for many, many patients. However, for younger patients, and in terms of understanding the science and looking at what may be able to achieve deeper remissions and potentially move towards cure, combination therapies with the novel agents are what's generating the most excitement. We don't have all the data yet, but there are some emerging patterns. Probably the first and a little bit disappointing is that BTK inhibitors, drugs like ibrutinib or acalabrutinib, adding chemotherapy or adding a monoclonal antibody, a CD20 antibody, are not particularly beneficial in that setting. Conversely, venetoclax, so the first BCL-2 inhibitor, anti-CD20 antibodies, either rituximab or obinutuzumab, are adding to the MRD negativity rate, so getting deeper remissions. So that appears to be a preferable component in the partnership. But then the combinations of a BTK inhibitor and a BCL-2 inhibitor are emerging as what I see as really the most exciting combinations, both based on the underlying biology as well as the preliminary data showing very, very rapid and very deep responses. Part of the goal here is not only to get deeper responses, so to kill more of the leukemia cells, but to do it in a relatively short period of time, because the economics of these are expensive drugs, and to make combinations economically justifiable, you need to shorten the duration of treatment. So that's why I'm seeing those combinations as being most promising at this stage.